Neurology quiz number 1. Which antibody in dermatomyositis is associated with the highest risk of underlying cancer? The anti-TIF1 gamma antibody is highly associated with malignancy in adults. Patients with the anti-MI2 antibody, on the other hand, have a low risk of malignancy and respond well to immunotherapy. What abnormalities can be seen on the brain MRI in patients with Fabry disease? These include cerebral infarcts, subcortical white matter hyperintensities, dolichoectasia of the large cerebral blood vessels such as the vertebro-basilar system, and hyperintensity of the pulvinar of the thalamus on T1 weighted images, also known as the pulvinar sign. These are images of the pulvinar sign and basilar dolichoectasia. Which anticonvulsants do not interact with oral contraceptives? The anticonvulsants that have no interaction with oral contraceptives include levetiracetam, lacosamide, zonisamide, gabapentin, pregabalin, vigabatrin, and tiagabine. What is the treatment for REM sleep behavior disorder, or RBD? RBD can be treated with clonazepam 0.25 to 2 milligrams or melatonin 3 to 12 milligrams at bedtime. In older adults, RBD can represent the prodromal stage of an alpha-synucleinopathy. The alpha-synucleinopathies are pure autonomic failure, Parkinson's disease, dementia with Lewy bodies, and multiple system atrophy. Many patients initially diagnosed with idiopathic RBD are eventually diagnosed with PD, DLB, and less frequently with MSA. What is the indication for using the dextromethorphan-quinidine combination, also known as Nudexta? The combination is used to treat symptoms of pseudobulbar palsy or pseudobulbar affect. The symptoms include pathologic and involuntary laughing or crying. Such symptoms occur in multiple sclerosis, traumatic brain injury, and neurodegenerative disorders such as ALS. This combination is the only medication approved for treating pseudobulbar affect. What is the mechanism of action of the recently approved abortive agent for migraine, Lasmiditan? Lasmiditan is classified as a ditan. It is a 5-HT1F receptor agonist and relieves migraine by inhibiting neuropeptide release with inhibition of peripheral trigeminal vascular and central pain pathways. It does not constrict blood vessels and is not contraindicated in patients with hemiplegic migraine, migraine with brainstem aura, coronary artery disease, etc. The major side effect is sedation. The dose is 50 to 200 milligrams taken as a single dose. Triptans, on the other hand, are 5-HT1B/1D receptor agonists, and they relieve migraine by causing vasoconstriction of painfully dilated blood vessels by a direct effect on vascular smooth muscle. In addition, they also inhibit release of vasoactive neuropeptides by trigeminal nerve terminals. Because of the effect on vascular smooth muscle, they are not given to patients with hemiplegic migraine, migraine with brainstem aura, patients with ischemic heart disease, patients with a history of strokes and uncontrolled hypertension.